Hello and welcome, ladies and gentlemen. Today I'm going to be talking you through this document, which is a decision support tool. I'm going to be talking about the domains, and the first one is breathing. I'm just going to show you what the nurse assessor is going to be asking and what information that they will be needing. I'm not going to go into how to write it today or the whole document. It's just purely going to be the breathing domain, and then I'm going to do other videos on each other domain as we go. So when you're talking about breathing, there is some overlap with all the domains. So first of all, what you need to ask is about the pattern of breathing. Does that person need oxygen or anything like that? So really the first question is there any diagnosis? So as you can see, if you get yourself the document, print one off or get one up online, you'll be able to see all this. So you've got chronic obstructive pulmonary disease or COPD, emphysema, anything like that. So any diagnosis. So we're talking about asthma, anything at all. So what you would have done before you started to do your DST would have got the GP summary, and obviously in this meeting you'll be getting verbal evidence from the social worker, from the nurse, from the family, and in some cases there'll be a solicitor there, but they won't be giving any information particularly. So you've got your diagnosis. The next thing to think about is, how is that being treated? If there's a diagnosis, do they have any oxygen? Do they have any medications? Do they have any inhalers? Anything like that. So you need to, when you're talking about those medications specifically for breathing, so you're not putting other medications in here unless that impacts on breathing. So what you want to do is you want the name of the medication, you want the dose and the frequency. If you're talking about oxygen, you want to know obviously the dose of the oxygen, how often, what's the flow rate, etc., and get your documented evidence for that. Things like blood pressure or pacemaker, anything that's going to impact breathing, that needs to be brought into this domain, and you need to talk about that. When that person is moving around, so even if they can't wait there when they're being transferred, is there any breathlessness on exertion? So that sounds silly to some people, that they're just being transferred, but in that transferring sometimes people get anxious as well. So the other things that will impact with breathing is if someone's anxious, or if they get frightened by something. Obviously that's going to affect the breathing pattern, so you need to take that into account as well. Do they have any recurring chest infections, so a history of chest infections? And just to say, with things like asthma, sometimes they can be diagnosed and then the person can recover from them. So what you need to do is say has been diagnosed with asthma, however they no longer suffer from this condition. So just talk about the history of that person, which you should have on the GP summary. If that person's had a chest infection, you need to state how long it lasted for and what medications treated it. If the medications, antibiotic, did treat it, was it to good effect, or does that person still have the chest infection and it's impacting on their daily life? So with breathing, is that breathing impacting on their daily life and their abilities to eat even? So some people their breathing is so laboured, even eating is a difficult thing to do. Anything like that. Is there any consultants involved? Is there any reviews booked with the GP or the consultant that has to do with breathing? When you're transferring as well, is there, do you need 3 carers for the transfer? So perhaps someone gets so anxious they need someone to keep them calm. So 2 other carers will do the transferring. but that other third person is needed to keep that person calm because they become really breathless because of the anxiety. You need to also speak about any machinery that might be used, any equipment, so such as BiPAP or CPAP, any cough assist, anything like that. Any physiotherapy that might be needed to keep the lungs working, and if so, how often, what does it entail? And you need to get the evidence reports that show what's happening. The equipment, will that be upgraded shortly? Will it be reviewed? Are there any problems? Things like deep suctioning. How often during the night and day does this occur? Also, it's helpful to get the SATs. So say the last 3 days of oxygen saturations would be useful. Behaviours. Obviously, anxiety is one thing, but perhaps they have behaviours where it makes it difficult to deliver the care or the medications or to engage with that equipment that they need to help them breathe. Do they need to be sat at a certain angle, or do they need to be a special chair to keep them upright so they can keep their airway open? Look in detail with every aspect of breathing, even if it overlaps with other domains, as I said, with like behaviours or anxiety. Don't be afraid to put overlap in each domain, because quite a few of them do overlap. So when it comes to writing this, I'll do another video to show you how to actually set the information out on the page, what kind of language to use, professional language. So I hope this helps you understand a bit more about the breathing domain and what information you're trying to get onto the page. So this is what all nurse assessors will be doing, and that is drawing out the information so it makes it easy for the Integrated Care Board or ICB to make a decision on eligibility. So your quality of information and the questions that you ask are very important, because things will be sent back to you to ask further questions. So let's get the information there in the first place. So I hope that this has been helpful to you. If you want to leave any comments in the comment section, I'd be very grateful for any feedback. Thank you very much for listening.